Hi, let's discuss about some important clinical skin conditions that you often see in your day-to-day practice. I can't say you often see in your day-to-day practice. It is relatively a rare one, but it is basically a spotter because when you see these findings, the diagnosis is 100% confirmed. It doesn't mean that you need to take the biopsy of the site to confirm your diagnosis. So today, let me show you not two skin conditions, three skin conditions, two skin conditions with respect to one particular skin problem and another skin condition due to another particular problem. Let's see these scenarios. Look at this. Right. What is the skin lesion? Tell me, what is the skin lesion? Anyone? What is the skin lesion called as? Look at this. You could see some papules over the dorsum of the foot, dorsum of the hand, I am sorry, particularly over the interphalangeal joint. There are some lesions in the proximal interphalangeal joint. So here it is evolving, but here you have clear cut violet shaped papules, papillosquamous lesion. What are all these papillosquamous lesions over these areas? Yes. So what is this? This is papillosquamous lesions. Where it is present over the dorsum of hand, particularly over proximal interphalangeal joint and distal interphalangeal joint, and also there are some lesions in the metacarpophalangeal joint, and it is violet shaped. What is it? And it is violet shaped. So these violet shaped papillosquamous lesions over the dorsum of the hand involving the interphalangeal joint is called as, can you tell me what is this called as? What is this called as? This is called as everyone knows, this is called as Gottron papules. What is this called as? This is called Gottron papules. A topic of rheumatology. This violet shaped papillosquamous lesions over the distal and proximal interphalangeal joints of the dorsum of the hand is called as Gottron papules. These Gottron papules are pathognomonic of a skin condition otherwise called as what? Juvenile dermatomyositis. What is this called as? This is called as juvenile dermatomyositis. Juvenile dermatomyositis. This condition is called as. Then, what is this lesion? Tell me, what is this lesion? What is this lesion? You could see some violet shaped discoloration of the upper eyelid. So, what is this? Again, this is violet shaped lesions involving your eyelid, and what is this called as? This is called as, what is this called as? This violet shaped lesions involving the eyelid is called as heliotrope rash. What is this called as? This is called as heliotrope rash. This heliotrope rash, why it is called as? Because heliotrope is a violet colored flower. Violet colored flowers. Heliotrope is a violet colored flower, and this is called as heliotrope rash. So these skin lesions, sometimes it can be associated with periorbital edema. It is associated with periorbital edema. So these violet shaped lesions involving the eyelid along with the periorbital edema is called as heliotrope rash, Again, it is pathognomonic of juvenile dermatomyositis. It is pathognomonic of juvenile dermatomyositis. Heliotrope rash. So the first one is Gotron papules. Hyperkeratotic papulosquamous lesion is called Gotron papules. And the second one involving your eyelid is called as heliotrope rash. In which condition this one comes? The answer is simple. As we told already, what are all the two skin conditions of juvenile dermatomyositis? Myositis. What is this? This juvenile dermatomyositis is an autoimmune disorder. Dermatomyositis is an autoimmune disorder involving skin plus muscle. Involving skin and muscle. So what is this juvenile dermatomyositis? The pathognomonic is you can have myositis in adults, but dermatomyositis is specific for pediatric age group. So two dermatological lesions. What are all the things we had seen right now? Dermatological lesion. One is heliotrope rash. And another is Gotron papules. Heliotrope rash is over eyelids and the Gotron papules are over knuckles. These two are pathognomonic of juvenile dermatomyositis. Major criteria. This comes under major criteria along with one of the minor criteria. So this is with respect to one minor criteria. So this is with respect to major criteria. Major means dermatological lesions, whereas minor criteria involves muscle. So what are all these muscle criteria? Elevated CPK as well as prolonged disturbed EMG, electromyography. Third one, you can prove this inflammation in muscle biopsy. But these things are often replaced now by an investigation called MRI thigh. Right now, the investigation for dermatomyositis is MRI thigh. Whenever you do MRI thigh, you will get hyperintense signals. That means hyperintense signals. That means it is inflammation of the muscle involved. So please remember Gotron papule of the knuckle and heliotrope rash of the eyelid are major criteria of a connective tissue disorder called as or autoimmune disorder called as juvenile dermatomyositis. You can have polymyositis, you can have inclusion body myositis. This polymyositis and inclusion body myositis are diseases of adult, whereas the disease inflammation involving children is specifically juvenile dermatomyositis, and the investigation of choice right now is MRI thigh. Right. Then what is this? Look at this. There is generalized hyperpigmentation. Look at this. There is generalized hyperpigmentation. I had highlighted the face of the child as well as face of the parents. The parents are not as blessed as the child. The child is very hyperpigmented. So this is generalized hyperpigmentation. What are all the causes that can produce generalized hyperpigmentation? Generalized hyperpigmentation. What are all the causes? You all know that. What is this? Your melanosomes. Your melanosomes pigmentation are mainly mediated through ACTH. So your melanosomes are stimulated by melanocyte stimulating hormone with the help of ACTH. When ACTH will be elevated when there is adrenal gland destruction. When there is adrenal gland destruction. This adrenal gland destruction is otherwise called as Addison's disease. Is called as Addison's disease. Remember, when any child is brought with shock, and when you see this generalized hyperpigmentation, it is Addison's disease unless otherwise proved, and they are prone to die because of hyperkalemia. They are prone to die because of hyperkalemia. One cause, generalized hyperpigmentation. What other causes that can produce generalized hyperpigmentation apart from this? One more pediatric condition is called as X-linked adrenoleukodystrophy. X-linked adrenoleukodystrophy, in which the adrenal gland is destroyed by, you would have learnt something about very long chain fatty acids. These very long chain fatty acids accumulates in the adrenal gland, leading to its destruction. Other causes for generalized hyperpigmentation are carbon baby syndrome. What is that? Carbon baby syndrome, which is characterized by increased melanin pigmentation of the child, leading to black discoloration throughout the body. Another cause is bronze baby syndrome. One is carbon baby syndrome. Second is bronze baby syndrome. This bronze baby syndrome is mainly due to the side effect of phototherapy. You all know that in which condition you will give phototherapy? Neonatal jaundice. In neonatal jaundice, you have one is indirect hyperbilirubinemia and the second is direct hyperbilirubinemia. Phototherapy is the investigation of choice for indirect hyperbilirubinemia, whereas when you give phototherapy to direct hyperbilirubinemia, there will be discoloration of the entire body because of the bilirubin discoloration of the skin, and this is called as bronze baby syndrome. So today you have learnt about heliotrope rash of eyes, Gotron papules of knuckles. These two belong to juvenile dermatomyositis. The second one is generalized hyperpigmentation. The causes are Addison's disease, X-linked adrenoleukodystrophy, bronze baby syndrome, as well as carbon baby syndrome. Thanks for your patient listening. Bye-bye.